The CDC is warning of possible COVID-19 surges as more cities look to ease public health restrictions. According to the agency, in the 100 days after mask mandates were first implemented, there appears to be a nearly 2% decrease in COVID-related deaths. But in places where restaurants are allowing for in-person dining, officials say there's already been a 3% uptick in COVID deaths. Yet despite this, some states are moving forward with lifting mask mandates, and the rollbacks are coming just in time for spring break, causing concern over potential super spreader events in places like Florida. Ahead of this, Miami-Dade's mayor says she will not lift the city's midnight curfew unless the 14-day average is at or below 5.5%. With more on this, let's bring in medical director and owner of First Call Medical Center, Dr. Ron Elfenbein. So, Dr. Ron, spring break has already started, and some people are traveling to cities with warm weather and beaches. How concerned should people be about the potential for the spread of the virus in these situations?
Yeah, so it's a good question. Kids are going to be kids, and they want to go out and party and have a good time and drink and fraternize and associate with each other and be in close proximity with each other. Obviously, the problem with that is that we're in the middle of a global pandemic, and as you just said, that there's actual data now that we've seen that's actually been around for quite some time, but the CDC just came out again with it to say that when they reduce these mask mandates or they allow in-person dining in restaurants, the numbers go up with the in-person dining. And by imposing mask mandates, the numbers go down. So we now have data to support what everybody's been saying for so long. So it's kind of like the perfect storm. You're going to have a mix of alcohol, young kids, and a potentially deadly virus that don't all mix well. And the problem is that there's this variant we've been talking about for some time, this B.1.1.7 variant, the UK variant, that's 50 to 60% more infectious than the quote-unquote usual variant that we've been talking about for so long. So coupled with all these things taken together, this is kind of like a perfect storm, if you will. And I hate that expression, but that's kind of what this is going to portend to be.
So we have more and more Americans that are fully vaccinated. And one of the questions people are asking is, what can they do if they are vaccinated? I know people who the second them and their spouses got the shot, they were on a plane ready to go on vacation. Do we know what you can do? Can you stop social distancing? Do you get rid of your mask? Is it time to go on vacation?
Yeah, so obviously there's so much fatigue, and people are so happy. You see these all over Facebook. Everybody's posting, I got my shot. They're super excited, and rightly so. But it's not kind of a get-out-of-jail-free card. You got to remember that just because you've been vaccinated does not mean that you cannot become infected with the virus. What it really means is that you're not going to die from the virus, and you're not going to get particularly sick from the virus. But it doesn't mean you can't spread it to other people. So just because you have your vaccine doesn't mean that you can't infect other people. So now is not the time to go see grandma who's been locked away for, not locked away, but kind of social distancing, if you will, for the last year, because you potentially could infect grandma with the virus. You're not going to get it, but she potentially could. So just because you have your vaccine doesn't mean everybody else around you is safe. So I think everybody just has to, wait until everybody else has been vaccinated. Now, if you've been vaccinated and the person you're going to visit has been vaccinated, then I think there's no problem. It's perfectly fine in a small group to take off your mask, to be with that person, to do whatever it is you want to do or need to do. But I think you still have to temper that with caution when you're around large groups of people.
Yeah,
and the CDC is going to issue a report on this. It just hasn't come out yet. I'm sorry to interrupt you, Vlad.
No, it's okay, doctor. And your point is well taken. I mean, we've had this conversation with my parents too. They've gotten their vaccines, and they're like, "Okay, kids, come on over." And we want to say, I'm like, "Ma, now you could make me sick." I mean,
right. That's right.
And so it's not because I don't want to visit you. I've been using that line for years. I don't know what I'm going to do when we're all vaccinated. I'm only kidding, Mom. But yeah, so I understand that people want to get back with their lives, and that was one of the questions I had too, is whether or not people can get on planes or if you can travel once you've been vaccinated. And so as these states begin to roll back their COVID restrictions, Dr. Elfenbein, at the state level, what would you advise local officials to do? Understanding, of course, that in addition to people wanting to see their loved ones or wanting to travel or and get some peace of mind, there are businesses and people who own those businesses who would, who have been suffering in addition to dealing with the pandemic, but with the economy as well. So what's that middle path that you would recommend for local officials to consider?
Yeah, I'm glad you asked that, because it's not all one or the other, right? I mean, you have the virus, which is dangerous, and then you have people's lives and their livelihoods, which they need to provide food for their families. So, it's kind of a give and take there. You got to remember that these numbers that they're looking at were also, to some extent, the restaurant numbers were looked at in places where there was no mask mandate. So people, was it the restaurants, or was it the fact that people weren't wearing masks around while they were going to the bank or doing whatever else they were doing? So those numbers are slightly skewed because you're looking at multiple variables. It makes it very difficult to make a determination one way or the other. I would say that, what we do here in Maryland, for example, is they very gradually increase the capacity of the restaurants, and that seems to have worked very, very well. And I would say that that's something that people should look at for their municipalities or localities, would be to, say, okay, we're 20% capacity. Next week, we're going to go to 30% capacity, as long as those numbers don't continue to rise. I think that makes a lot of sense, and that kind of keeps people safe. Just slowly increasing the capacity of the restaurants and making sure that everybody still wears their masks and still practices social distancing as best as possible. So there are ways to do it, just being safe and being careful, rather than just making it an all or none approach.
All good advice. Dr. Elfenbein, thank you so much.
Thank you. Have a good day, guys. Stay safe.
You too.